Blacks. The panel will be moderated by Dr. Barbara Neighbor-Stevens and Dr. Ivan Walks. Dr. Randall Maxey won't be joining us today, but we certainly wish him well. So a little background about our mission. Black Health Trust was founded in response to the coronavirus global pandemic and Dr. Randall Maxey's personal desire to keep his own family safe. And fortunate for us, his commitment to informing his tribe evolved into a much larger vision that we can all share. The purpose and mission of the Black Health Trust is to provide credible insights from our community of health experts to best serve our communities of color with a coalition of leading and longstanding Black medical professionals across a diverse spectrum of disciplines to offer their expertise and insights into our physical and mental health during these challenging times. These opinions are offered to help educate and inspire you to take your health seriously and to ask questions of your own medical practitioners. Now I'll share a few housekeeping items and announcements. This video conference is a live program and is being recorded on different public platforms like Facebook Live and YouTube. Your participation on the program is completely voluntary, and if you choose to participate today and prefer not to have your image and likeness displayed, there are visual and audio settings on your personal device that you can control. That said, all participants will be muted by our Zoom technician. We ask that you remain muted until the host or moderator asks you to contribute in order to minimize the distraction of background noise so we can give 100% attention to our valuable speakers today. With regards to the chat room, if you have questions, we hope you do, you can enter them into the chat room. Please limit your questions to 2 questions per topic being addressed, and please do not use this forum to advertise or promote your personal products. Understand that there may not be enough time to answer all questions, but we'll do our best. So now I'm going to read the disclaimer for the program. Please note that the information communicated on this program is not intended or deemed to be medical or legal advice, and you should always consult your own medical or legal professional for advice and direction pertaining to your particular situation and needs. The information presented here is not advice, but rather opinions and recommendations from credible sources. Black Health Trust, its representatives, members, employees, attendees, heirs, assigns, and guest speakers and presenters assume no liability whatsoever in connection with the information presented or used by anyone here, nor are these discussions directed to specific situations. Again, we strongly encourage all attendees of the program to consult their own legal and medical professionals for conclusive guidance on how to proceed in your own personal circumstances. So that said, we are in this together. We are still in this together. If this programming is or has been valuable and interesting to you, please visit the website to learn more about our programming and how you can support Black Health Trust so we can continue bringing our community outstanding content. Visit www.blackhealthtrust.org. That said, if you send an email to social@blackhealthtrust.org, please include your first and last name so that you may be added to the Black Health Trust mailing list. If you don't want to be included in the mailing list, please just indicate that in your email. So now we want to give thank yous. We want to thank the Black Health Trust Steering Committee, the Executive Board, its virtual administrative assistant, our media production and Zoom technician, BHT supporters, sponsors, and all the people behind the scenes for their time and efforts that make this programming possible. Let's now also welcome all of our distinguished physicians and special guests today. We thank you in advance for sharing your valuable time, information, and educated insights with us. Your participation, support, help empower our communities of color. And this is so critical to our present and future well-being as a people. Like I always like to say, Black is beautiful and knowledge is power. So welcome again, everyone, to the Black Health Trust Weekly Program. This is our community. This is our time to take care of our health. Grab your tea, coffee, or whatever helps you lean in. And Dr. Neighbor-Stevens and Dr. Walks, please do us the honor of moderating today's program.
Thank you so much, Michelle. Good afternoon, everyone, and thank you so much for joining us this afternoon. We're very excited about the program that you're about to receive. And as usual, before we get started with the programming, we're going to review the week's statistics. Simon, that slide, please. So this data is taken from the CDC's COVID-19 tracker on the CDC website. It is accurate through about 1 o'clock yesterday afternoon. They are reporting a total of 28,714,163 total cases in the United States, with total new daily cases yesterday of 67,484. Total US deaths through 1 o'clock yesterday afternoon was 521,294, with the total US deaths for yesterday being 2,230. Looking at the vaccinations, next slide. We have, if you recall from last week, the Black non-Hispanic statistic was around 6.4% of the total vaccines that have been received, of the ones that could be tracked with data. And we this week are looking at 7%, which means that we have crept up just a little bit, but we still have a long way to go. Having said that, and we will be talking about vaccines and vaccinations and COVID much more as the afternoon goes on. At this time, let me introduce my co-host and partner in this endeavor, Dr. Ivan Walks. Welcome, Dr. Walks. If you'll recall, Dr. Walks is a psychiatrist, a graduate of the University of California at Davis, having done his internship and residency in psychiatry at UCLA School of Medicine. Dr. Walks has had a distinguished career and has served in the public health sector as a former District of Columbia Chief Health Officer. He has done a stint in the US government as a consultant to presidents, and currently works as the CEO and founder of his consulting company. So without further ado, I'd like to turn it over to Dr. Walks.
Thank you so much, Dr. Naybert-Stevens. It is always the highlight of my week to spend this time on Sunday afternoon. I get to be around people that I like, and I get to learn, and I'm always happy to learn. And when I think about that, I can't think of anybody I want to learn from more than my friend, Dr. Hood. It's my honor to introduce Dr. Hood again. And a couple of quick things about Dr. Hood. If I were to read his entire CV, we wouldn't have any time left for the Black Health Trust. I think I would about 5 minutes to 5 this afternoon. But Dr. Hood has spent over 40 years in medical practice in Southeast San Diego. He serves on the editorial board of the Journal for Racial and Ethnic Health Disparities. Dr. Hood co-founded and became president of an independent physician association, or an IPA. And maybe one of the things that I'll say about Dr. Hood that I think is remarkable in two ways. Dr. Hood is the 101st president of the National Medical Association. That means that the organization was around for a very long time and established itself. And so when we talk about the NMA, it's important to think about the fact that it had a 101st president. And when you've been around that long, the person that you pick is usually someone of great distinction. So that says a lot about Dr. Hood. So I just want to introduce Dr. Rodney Hood as someone who is renowned for his expertise and is a great teacher. And maybe that part of his CV is the part that's going to really help us the most today as we look to Dr. Hood to introduce the rest of our panel and get us started. So Dr. Hood, good to see you again.
Very nice seeing you, Dr. Walks, and Dr. Naybert-Stevens. Thank you for the introduction and the invitation. And I also want to thank Dr. Randall Maxey for the invite and wish him well in his healing. So today, you're going to hear about your southern neighbor in San Diego, what's happening in San Diego County as far as outreach and advocacy around COVID, specifically for the African-American community. If I can share my screen. Okay. So what we're going to talk about is organization that I'm president and chairman of the board of the Multicultural Health Foundation, uh, instituted a COVID-19 equity task force here in San Diego almost a year ago. Part of the executive team includes Dr. Robert Gillespie. Dr. Gillespie is a cardiologist at Sharp Steele here in San Diego. He's cardiologist expertise. Most physicians who are Black in San Diego consult or go to Dr. Gillespie on a regular basis. He's very active in his church, Bethel AME, and he served as a distinguished member of the Association of Black Cardiologists and was actually the chairman of the board of the Black Cardiologists for several years. He serves on the Equity Task Force as the lead trusted messenger for the vaccine distribution. You will hear from him shortly as far as some of his community-based intervention. The other is Dr. Susan Afalo, who is not with us here today, only because she had to travel. She's a retired family medicine doctor from Kaiser, who is very active in her church in Southeast San Diego and is the lead testing vaccination distribution advocate. We have a student minister, Abdul Muhammad, who is founder, CEO of I Am My Brother's Keeper. He's part of the executive team, will not be presenting today, but leads a very significant portion of the task force in intervention with food insecurity. Uh, with us today are the Multicultural Health Foundation consultants who actually manage the grant that we received from the county. Ms. Cynthia James Price is the project manager. She has a history of serving in the military, served and worked for, I believe it was Pfizer as a sales manager for many years, and we're lucky to have her in San Diego leaving the project manager position for the foundation. And then we have Ms. Leah Goodwin, who's serving as the media campaign liaison for the outreach that we have to the Black community. Leah is expertise in media, uh, uh, convention planning, etc. But she's working very closely with our community health workers in the media campaign. And I'm going to ask both to kind of highlight their bios a little bit more when they get to the point of their presentation. So what I wanted you to hear is you're going to hear from me. I'm going to give a brief overview as to the task force. You're then going to hear from Dr. Gillespie, who's going to talk to you specifically about the trusted messenger and vaccine distribution. And then you're going to hear from Cynthia and Leah about the grant. So the vision of the Multicultural Health Foundation is that all residents of the county in San Diego should achieve health equity, improve longevity, and better quality of life. And our mission was to bring health justice and wellness to the multicultural communities of San Diego by focusing resources on the most vulnerable populations with the community-based wellness strategies that included social clinical interventions, research that would lead to the elimination of racial and ethnic health disparities. At the about a year ago, similar to Dr. Maxey, when the COVID hit, I was still seeing patients. It was clear to me, anybody in the Black community and health community that has been following the health data and health statistics, that any catastrophe pandemic was certainly going to hit the Black African American community harder than anyone else. And at the urging of some of my patients and some of my colleagues, um, myself and others formed the COVID Equity Task Force of San Diego County. Its purpose brought together community stakeholders organized to discuss, advocate, and help implement policies and strategies to address the disproportionate negative impact this COVID pandemic uh, began inflicting on the diverse populations in San Diego County. Our strategy was simple: follow the equity principle. What is that? Monitor frequent data that focused on place and race, and based upon that, recommend and implement policies and solutions based upon need. Um, Over the past year, we've seen the task force grow from less than a dozen to now over 150 participants. I think the number is close to 200. We have now monthly meetings, and we usually get about 40 to 60 participants every meeting. This task force serves as an incubator for community-based solutions for equitable COVID-19 intervention. It is responsible for spearheading free COVID testing in the highest impacted communities. It influenced the county and the state to distribute multi-ethnic COVID-19 outreach grants and education grants to Latinx, Black, Asian, and immigrant communities. And it serves as a community resource for COVID-19 updates and education. Uh, Not only the community, but the media frequently calls members of the task force to do interviews and update them on equity issues as far as COVID-19. And it also is synergistic in equity collaborations. And I'm going to show you that over here. So this is the multi-ethnic physician, nurses, healthcare providers. These are physicians of all different ethnic backgrounds, nurses of all different ethnic backgrounds. But I'm proud to say it was the African American physicians and the local NMA that kind of led this organizational strategy. At our COVID equity Zoom meetings, we have members of the San Diego Department of Health and Human Services. So there's always somebody on there. They listen very attentively. We know that because after our meetings, many of our recommendations are implemented as far as the equity distribution of testing, vaccination, et cetera. We also have state and local elected officials from city council members, board of supervisors, and yes, even at the state level, frequently participate in our meetings. Dr. Shirley Weber, who just became the Secretary of State, has been a frequent participant in our meetings. We have multiple faith-based participants. One of them, Minister Muhammad, is on the executive team, and he actually leads the food insecurity outreach, which is delivering food to hundreds of families every week in San Diego. We got the UCSD, San Diego State, university and academic representatives that participate in our meetings. We have community-based organizations, fraternities, churches, et cetera. And then we got multiple immigrant and ethnic organizations, and we hear from them all. And what I mean by synergistic collaboration is Alliance Healthcare Foundation is a small foundation that's in San Diego, participates in our meetings, heard one of the discussions, and donated and was responsible for donating a grant to the Multicultural Health Foundation dealing with vaccine hesitancy of $30,000. We have the San Diego County District Attorney who made a presentation to our COVID Equity Task Force on domestic abuse and other issues around COVID. And one of our community-based organizations who deals with domestic abuse actually wound up getting a grant because of the rise of domestic abuse during COVID. One of the HMOs or managed care organizations representative participates in our meetings, heard the need for food distribution around food insecurity, and actually gave a grant to My Brother's Keeper, Minister Muhammad's group, to assist him in distributing food right in Southeast San Diego. And then we have the Board of Supervisors. If they're not there, their staff is there. That actually resulted in us getting the grant and other financial policies that have taken place in San Diego. So you can see this is not just a community-based entity. We are linked to where the power is, and the power seems to be listening. Um, Early on, our focus was equity testing and food insecurity focus. This is us advocating. I'm proud to say that Equity Task Force really was responsible not just for the Black focus in funding to outreach to Black communities, but I think led the way in bringing all the racial and ethnic communities together to kind of get funded. Dr. Follow, who's not with us, this is us when we opened up one of our first testing sites. That was it started out as a mobile unit at 286 Euclid, is where my office is. And evolved into a drive-through a testing site that is still open today. This is in Southeast San Diego, high African American, Latinx, Asian community. Over here, shortly thereafter, we had the first 20, it was a 7-day a week, 8:30 to 5 p.m. test site. It was free. It was no appointment only. If you didn't need an appointment, and it rapidly became the busiest test site in all of San Diego County, testing close to 1,000 individuals a day. This is still open. It is now being shared on certain days for vaccination. And this is some of the outreach in media. This is a billboard near my office encouraging the community to get tested. The whole principle that we tried to work on is called the Health Equity Matrix based upon Healthy Places Index, which is a process adopted by the state where community-based equitable data tools are used. Each community area receives a Healthy Places Index score, and this score is based upon 8 social determinants of health, which are economic, your socioeconomic status, the educational level of the geographic area, what the transportation issues are in that area, the other social barriers that exist in that area, the safety of the neighborhood, the housing issues in the neighborhood, clean environment, health disparities, and all of these get a number. And of course, the lower the number, the less healthy the indices. And that data is used or was used. These are actually, these little black dots are test sites throughout the San Diego. This is San Diego County. If we draw a line going across here, west to east, there's a highway called Highway 8. North of Highway 8 is the more affluent members of San Diego, and south of 8 is where we have the highest density of the underserved. And as you can see, using that health equity matrix, the county with our advocacy did quite good establishing sites in the most needed areas. So now we're going to vaccination. That was testing. And this is a dashboard of San Diego County. How are we doing with vaccinations? I've been told that San Diego has been the #1 county in the state as far as efficiency of vaccinations. As of the 6th of March, they had received 1.1 million doses and had been able to administer 1.03 doses, 95+%. If you remember in the beginning, due to capacity and storage issues, the efficiency was down to about 20–30%. San Diego's gotten very efficient building up capacity, et cetera. The problem here is not capacity, but shortage of vaccine. This is the success to date. There have been 629,000 plus, or 23% of the targeted population of San Diego residents that have been got at least 1 dose. Fully vaccinated mean 2 doses at 12.2%. I will focus over here, which is talking about who got it by race and ethnicity. And as you can see, in San Diego County, the hardest hit populations, Latinx #1, African Americans #2. In spite of that whole equity matrix we talked about, only 17.1% of Hispanics have received vaccination, and only 2.3% of Blacks have received vaccinations. On a national scale, we know that Black and Hispanics are at the greatest risk of hospitalizations and death. When it comes time to COVID, Blacks are 3.1, Latinx 4.1 times greater at hospitalization, death, almost 3 times both Latinx and Blacks and Latinx compared to whites. When we're talking about comorbidities, the more comorbidities or the number of comorbidities you have increase your risk to severe disease. And this is just pointing out asthma, hypertension, obesity, diabetes, etc. And the more you have, all the way up to 5 or 6 times increase your risk of severe disease. And as we know, Blacks have higher rates of these comorbidities. The other criteria that they used for equity criteria was age. So going back here, they used this 18 to 29 as the comparison group, and comparing it to the 18, 29-year-olds, the older you are, especially when you get up to around my age, 5 times greater hospitalization, 90 times greater death. So that was the rationale for distributing and prioritizing vaccinations by age, 65 and older and 75 and older. That seemed fair. However, when you really look at the data by death, race, and ethnicity, whites, 88% of the deaths in whites are 65 and older. On less than 65, only 12%. For Latinx, it's 37% less than 65. And for Blacks, it's 27%. So minorities are dying much younger than whites. If we look at less than 50, we can still see that's still the case. Minorities are dying at much higher rates at younger ages. So therefore, what seemed fair to prioritize by age or age alone, greater than 65, greater than 75, was really favoring whites over people of color, especially Black and Latinx. And like to point this out, in 2017, the average life expectancy in the United States was 78.6 years. For Asians, it was 86.5. For Hispanics, 82.8. For whites, 78.9. For Native Americans, 76.9. And for Blacks, 74.6 in 2017. Something interesting happened. When they compared life expectancy in 2019 with the first 6 months of 2020, there was a drop in life expectancy of 0.8 years for whites, drop in life expectancy for Hispanics of 1.9 years for Hispanics, and drop in life expectancy for Blacks of 2.6 years. That is significant. And so when people want to talk about the risk of the vaccine versus the risk of COVID, I think this is the most significant statistic. But one of the questions I raised or we raised at the COVID Equity Task Force is, therefore, should combined age, race, ethnicity-based priority be lowered to greater than 50 years for people of color to be more equitable? I think the answer to that is yes, but most folks who are on this phone know that that is not something that this country feels comfortable dealing with, although they realize race is a independent variable in itself, maybe even more sensitive than socioeconomic status and where you live. When they try to compensate for race, it's usually indirect, using socioeconomic status, et cetera. I think the most direct way to avoid some of the unintended consequences is to just use race. And what I mean by that is This is San Diego County, and I think this is similar all over the country. San Diego has only 5%, little over 5% of the population is Black. 2.3% of Blacks have been vaccinated. A month ago, it was 2.1, so there is some improvement. With the white population, they make up 45.1%, yet 47.8% of them have been vaccinated. A month ago, it was 49.7, so that it did improve. Latinx, same thing. They make up 32.6% of the population in San Diego, yet only 17.1% have been vaccinated, up from 15.9 about a month ago. And up here is really just showing you the north part of the county is where the more privileged population live, and the impact of vaccinations, in spite of the fact that there are more vaccination sites down in Southeast San Diego and the South, they still seem to be getting vaccinated at greater rates. So real quick, I think I showed this before. This is the hesitancy as far as getting a vaccine. This was by race and ethnicity. As you can see, Blacks have the lowest response when you asked about vaccination. This is from a Pew Research Center data. This is asking the same thing, but a survey by Pew was done in May and then again in September. And when we looked at gender, age, race, ethnicity, and education, we can see a drop in the trusting of the vaccine. And there was a lot of mismessaging going on with the previous administration. The trusted sources, CDC, FDA, were not as trusted because of the mixed messaging. But as you can see, Blacks were at the lowest. They went from 54 to 32%. And the disparity is the greatest with race than it is even with education, age, et cetera. So if we're going to do anything about vaccine hesitancy, all populations need a focus, but Blacks need it much more. And to combat that, San Diego County funded a demographic, racial, and ethnic focused outreach initiative. For the first time in its history, they gave out significant grants to community-based organizations. The Multicultural Health Foundation, which the COVID task force operates under, is focusing on the County of San Diego Black African American population, about 170, 180,000. Mental Health of America is another entity focused on Black African Americans. There's a Chicano Federation collaboration that includes 4, 5, 6 organizations together focused on the Hispanic Latinx. United Pacific Asian Community focused on Pacific Island and Asian. Women of East Africa, Somali Clinic, Refugee and Immigrant, and Native American. So for the first time since I've been in San Diego, they did not give this to a large organization to focus on community organizations. They gave it to locally involved community-based organizations to focus specifically on the most impacted communities of the COVID. So this is just a survey of African Americans asking, who do you trust to give honest and factual information about COVID? Doctors and nurses were the highest. I've seen some other surveys. If you asked about Black doctors and nurses, they were even higher. Local hospital, public officials, Black elected officials, Dr. Fauci was up there. So when we develop trusted messages, this is the group we kind of try to get to start giving the message. And in order to do that, we see vaccine hesitancy in Black community, any community, in 3 groups. You got the vaccine acceptor. These are the ones that say, hey, I'll take it. When is my turn? And the issue is overcoming the issues of access and cost. So even though they're willing to get it, from the chart that I showed you earlier, they're still having problems with access and cost. And I'm going to show you some of the strategies we're using to overcome that. Vaccine hesitancy. targeted outreach to the African American community with education, scientific data, trusted messengers, engaging faith communities, sororities, fraternities, and healthcare providers. And we really believe we're in a community. We approach all with love, knowledge, and understanding. So there are some folks, no matter what, because of holistic beliefs, because of religious beliefs, because of distrust, are just not going to take the vaccine. We encourage safe mitigation, healthy lifestyle, physical distancing. I'm a true believer in vitamin D, C, and zinc, and I know you've had sessions on vitamin D, and I encourage all my patients to do that. So with that, this was the website of blackcovidfacts.org back around the holidays. We had a special program focused on keeping families safe during the holidays. And with that, I'm going to end my presentation and ask Dr. Gillespie to.
Thank you, Dr. Hood. Hello, everyone. Black Health Trust, thank you very much for inviting me to participate. Dr. Hood, thank you. Dr. Maxey, thank you. I will now follow up on a wonderful presentation by Dr. Hood. And some of my presentation I'll be able to shorten because some of that information was shared with you. Let me just see if I can share my screen. Sharing the sound.
They want you to turn up the volume on your microphone. They can't hear you that well.
Are you able to see that?
Yes.
You are. Thank you very much. So today I will spend the next 15 minutes on discussing messaging and vaccinating in our communities, a targeted approach. I take a lot of pride in being in the trusted messenger lead for the Equity Task Force. Thank you, Dr. Hood, for that. And I take a lot of pride in working with the San Diego Black nurses, who I think is an absolutely exemplary group for our country and for how we should treat our patients in the community. My role as the trusted messenger really began at my church. Rodney, Dr. Hood mentioned that earlier. Bethel AME, my pastor at the beginning of March, he said, "Bob, I need you to come out and talk to us in church about this new virus." I knew very little, just like most of us on this phone. Last year in March, didn't know a lot about the virus, but I did my research and started giving a weekly message for the first couple of weeks in church when we were still open. And then we transitioned over to a video format, an online format. I was fortunate enough that my son, who's a senior film student at LMU, had to come home also. So he was able to videotape a lot of the sessions. I'm going to show you just a quick one. I hope it will show through here. This is a 2-minute video.
Hello, I am Dr. G on behalf of the Association of Black Cardiologists. Over the last several months, we have learned a tremendous amount about COVID-19, including the devastating effect it has on minority communities, killing Black and brown people at an alarming rate. We also have long known African Americans to have higher presence of diabetes, high blood pressure, obesity, and other chronic conditions. These conditions, if not treated, likely increase the risk of getting seriously ill from COVID-19, and also, if ignored, cause complications and death unrelated to COVID-19 simply because you aren't getting appropriate medical care. The good news is preventive measures, including social distancing, hand washing, and masks, have made a significant difference. Some studies have shown that the incidence of COVID-19 amongst healthcare workers to be less than the general population as a result of careful precautions in the healthcare centers and by compliance with the guidelines. Unfortunately, many patients continue to avoid seeking medical care. Now is the time to come back for all of your healthcare needs. We now know much more about COVID-19. We know how to protect you and ourselves from the virus through appropriate safety measures. Telehealth services are available for most patients, and for those who require face-to-face care, we are here for you also. If you feel ill and need immediate care, do not hesitate to do exactly what you would have done prior to COVID. When appropriate, don't hesitate to go to an urgent care or an emergency room. We are prepared to provide a safe visit. If needed, call 911 for emergencies. Remember, time is not a luxury when immediate care is needed for serious problems such as heart attack or stroke. If you're having persistent chest pain or extreme difficulty breathing, call 911. Remember the FAST or the FAST warning signs for stroke: facial droop, arm weakness, speech difficulty. Time to call 911. Remember, it is not only safe to get medical care now, it is necessary. Thank you.
Okay, so our focus on the presentations have evolved. That was in December. We're now in a new phase. So every week I'm still providing a video for my church that is also shared with other community churches, and also a task force can use that information as needed, and we post it on our website. One of the things that Dr. Hood mentioned is vaccine hesitancy. We now know that we've made some headway with African Americans, but our numbers as of last month in San Diego County, there was a 36% hesitancy that people were saying they're just not going to take the vaccine, African American, that is. And that's much higher than the average in San Diego County. Many of this starts with myths. You may remember when this virus first came out, the first myth was that Black folks don't get COVID-19. I couldn't believe it, but that was the first question I was asked when I had a church session. Over the time that we've been dealing with this virus, we figured out a way to deal with these myths. On our website, we do that, as well as when we go out and speak with our folks in the community. One of the things I thought would be very important was to join a trial. So I joined the Moderna trial. I must admit, I waited a long time because I wasn't quite ready. And that's why when we talk to our patients, we have to understand that all of us are ready at different times. I wasn't the first in line to get in the trial, but I got in it. And there are going to be many of our patients who aren't going to want to get the vaccine right away. Keep working with them and continue to work on myths and other factors that are keeping our folks from getting vaccinated. Rodney already went over this. I just want to make a quick point. He's already talked about the numbers that we've had over time. Let me see if I can move this over. You can see on this slide that the vaccination rate per 1,000 for African Americans in February was 45 per 1,000, or 46 per 1,000, lower than any other group. This is now this month's data. It's the next slide. It's not advancing. There it is. You can see now we have made some improvement. We're up to 92 per 1,000, but the other groups have also made improvement, and we still lag way behind everyone else, the lowest being African Americans and Latinx communities. So 92 for African Americans out of 1,000, 107 out of 1,000 for Hispanics, whereas 215 out of 1,000 for whites. The average being 203 for Blacks, 92. So we're less than half the average folks in this community. So we have a lot of work to do. The start of that work goes back to what I mentioned to you earlier for at least a part of that work. These two fascinating and absolutely wonderful ladies have led that charge. Our president, Samantha Gamble Farr, is a very busy nurse and nurse practitioner at UCSD, but she has vision and has allowed this process to be a part of our next step. Our champion is Samantha Williams. She is our champion. As you all know, as physicians and as other and lay folks, any cause that we have, you have to have a champion. She's clearly our champion. And she's the one that makes this show run. And we are very fortunate to have her. So what has this organization done? Our first event, which I'll go over, was about a month or so, roughly a month ago. I'll give you the details of that later. These are just some photos from that very first event where we almost vaccinated roughly 200 people, and actually 188 people that day. The thing to keep in mind, whenever you have these events, you got to feed your folks if you want them to come back. So we made sure they got fed well, but the ladies did a wonderful job in putting together and administering the vaccine. These are just, again, some other photos. This is our second event at City of Hope. I want to make a point about this event, and this is what you call communities in action. One of the things that the county does, if you have a certain number of vaccines that are allotted to you, and you don't use those vaccines within a 7-day period, they want you to return the vaccine. We were not about to return any vaccine, but we realized that we still had enough vaccine to move on to another program. So what we did is, with the help of Dr. Susanna Flalo, who is a community champion unlike any other, We called her church, a City of Hope. Between the San Diego Black nurses and our hard work, we were able to pull together an event within 4 days. And we were able then to administer over 200 vaccines at that event in a 4-day time frame. So what we have done so far, our first event was on February 17th. And again, I want to make a really important thing that we have contacts for each of these. It's very important to work with organizers within these different organizations. And you can see our first event was 188 vaccines. Our second event, 4 days later, this had not even been on the forecast when we did this event. We were able to pull that together, and we had 237 vaccines. And then when we had our next event, was intended to be a small event, 41 vaccines. And then our church at Bethel A&E, 261 were administered. Now I want to point out, and I'm going to get a little bit more into detail a little bit later, we are anticipating our next event is going to be between 600 to 700 vaccines. And you can see that that's roughly 1 month after our first event. So we will have those 188 combined with this event to get their second shots of the Moderna. We're using exclusively Moderna vaccine at this time, though I know that will change, especially when the J&J vaccine comes in fruition for us to get our hands on it. I also want to point out that Dr. Aflalo, in conjunction and with the help, I should say, with UCSD and the San Diego Black nurses, they did 410 vaccines at the YMCA on March 3rd. One of the few days it's not sunny in Southern California. That day rained. Normally this would have been done with a mobile van in place. They had to move it into the YMCA. Again, another point that we always have to be on our toes to move things and change things when things happen such as rain. So our total numbers so far, not including what we anticipate and not including the 410 at YMCA, is 727. You double that once this event occurs and you add another 410, you see that we are quickly moving our program to the point where over 2,000 vaccines in roughly a month. So what have been the lessons learned so far? First of all, I can't begin to tell you the pleasant feeling it is to have the community around you when you go to these events and the positive feel you get from it. It's one thing when I'm doing my videos and I'm in my office or in my office on a one-on-one basis with my patients, but to come into these events is very, very rewarding. It's clear that the comfort level increases significantly within our population when we're present. And this is a real point all of you should take home. We were able to get 97% of our targeted population, meaning 90% of the folks that we vaccinated were African American. And we specifically were able to do that because we kept it off the grid. What happens if you put it online and you have it on grid, people search it on the internet, and when you go into our neighborhoods, you won't see necessarily the representation of that neighborhood. And that's because everyone's doing what they should do. They're trying to get the vaccine. But the point is, you take it off the grid, you have community and church organizers put it together. You go to a church and say, listen, talk to your members, get them on the list. And if you have already filled up your numbers, go to your sister churches and bring them in. Bring in the community or whatever you have to do. I take pride in Bethel when we did our event, because my church had been listening to the trusted messengers. We had less number of people who needed vaccination within their tier because they'd already been vaccinated. But we were still able to fill up and use all of our vaccines because we had a lot of folks in the community who did need to be vaccinated. We schedule both drive up and walk up events. They're both very effective. They require a lot of time and planning, but you each have unique things that you have to work out, but both are quite effective. Important to always provide, as many of you on this line have gotten vaccines, or some of you at least, we know that afterwards we have to measure and monitor the safety of our vaccine. So there's a V-Safe system. It's a smartphone app that people can download and send in the information on V-Safe. This is both in English and Spanish. So what's coming up? This is what's coming up very soon. And this is when the floodgates will open. We have to be prepared. As of March 15th in the state of California, it will be 16 to 64-year-olds. And that's going to be 16 to 64-year-olds with either disabilities or pre-existing conditions. What are those conditions? Cancer, chronic kidney disease, stage 4 or above. Again, they do qualify. COPD or chronic lung disease, Down syndrome, immunocompromised states, pregnancy, sickle cell disease, heart conditions, but I want to make a very good point here that excludes hypertension. So hypertension is not included as one of those in this target group. Severe obesity and type 2 diabetes, not type 1 diabetes. These are the groups that are being targeted. Well, I want to make another very important point for those of you involved with vaccination. And this is critical for our folks. One, we clearly as vaccination centers have an obligation to clearly describe the groups who are eligible when we speak to our folks. The vaccinators must have a system in place to support that good faith effort. But the last point I really want all of you to take home, I want to read it to you. To ensure equitable access to vaccination, it is acceptable for these good faith efforts to include verbal attestation from the patient that they meet the criteria when documentation is not available. That was as of February 2nd, 2021. You can search that and find that information. Why is that important? We aren't in the business of having people bring medical records to us at a vaccination site in the community. That's ineffective. When we first started our programs with San Diego Black nurses, we always had them document written form that they were truly what they said they were if they were outside the tier. For instance, you have the caregivers that are formal caregivers and informal caregivers. Informal caregivers are those who take care of a disabled or someone over the age of 65 in their home or outside of their home. We had them sign those forms. We don't have to do that anymore. All it takes is verbal attestation. Very important for our communities. What are our future considerations? I already mentioned the floodgates are about to open on March 15th. We have to be ready for that. It's going to be based on honor system, not medical records. That's not the expectation. Our messaging will be very important because we also have to point out the details of the J&J vaccine. Many of you have already heard the efficacy numbers, one being more efficacious. That means the Pfizer and the Moderna having higher numbers compared to the J&J. There's some concern that the J&J, that some people may be concerned that it's not as good. Let me just tell you, that information is not true. We know that we are going to go into the details right now. Later on, if we have time, we could talk about that. But the bottom line is we have to come up with the right messaging for our population, for them to understand when they go for a vaccine, get whatever vaccine you can get. Don't try to pick and choose. Get a vaccine. We can talk more later. Hesitancy is highest amongst younger people, not older. And for lots of reasons, because we know what happens with this vaccine, this virus, it kills older, not younger in most cases. But the problem, as a clinician who takes care of a lot of patients with COVID, I've seen many cases where the person who dies is because their younger daughter or son brings the virus into the home unwittingly. And that's because 56% of the people who get this virus are asymptomatic or pre-symptomatic, and they transmit it to other people. We have to get rid of this whole second shot anxiety thing. This thought that you have to have your Moderna or Pfizer vaccine at either 21 or 28 days. There's a lot of data that shows that that's not necessary. We're getting a lot of people who are very concerned they have to have it on that day. Again, question and answers, we can get into that later. But lastly, I want to say we have to continue to expand our community-based vaccination programs. It's essential. I want to say it again, it's essential for African Americans. If we're going to be successful, it has to be done on a community level and not these large vaccination centers only. With that, I'm going to end, and thank you for your attention. I'm going to stop sharing. Okay.
Yeah. So with that, Cynthia and Leah, I think you can give your presentation, and then what you're going to hear about is the outreach program, and then we'll go from there.
You're muted.
Good afternoon. Can you hear me now?
Yes.
We can hear.
Thank you so much. Let's go back. First of all, thank you so much, Dr. Hood. Thank you, Dr. Gillespie, for sharing that information. And thank you to our host. And I want to thank everybody for taking time out of your busy afternoon to be here with us, because clearly this is important to all of us. Our host said at the inception of this program that we are working together in this fight against COVID. And if you can look at our screen, and this is our landing page for our website currently, Together Against COVID. We take this very seriously because those numbers on the pages are not just numbers. That's somebody's mother, father, sister, brother, aunt, uncle. These are lives that are being lost to this pandemic, and they don't have to be. So our goal is keeping San Diego's Black community safe from COVID. Our goal at inception has been, and it continues to be, to mitigate the spread of this virus among African Americans. And Dr. Hood showed you some slides. Yes, we account for 5% of the population in San Diego, but we also account for one of the highest rates of incidences, over twice as many. And then when it comes to vaccinations, only 2.1%. So therefore, it is so much more important and so critical at this juncture that we continue to provide our population and our community with the resources that they need to get the valuable information to make those informed decisions. Knowledge is truly power. So Dr. Hood has already talked a little bit about the funding from the county to make sure that those populations that were affected receive funding so that we could target our population. Our population in San Diego for Multicultural Health Foundation is African American / Black. Unapologetically, we are targeting the African American and Black population. And the way that we've chosen to do this is a multifaceted approach with 3 strategies. One is a universal approach. That's kind of a broad stroke approach where we use television, radio, social media, our website, our e-newsletter, outdoor marketing with billboards and bus sites. And then we drill it down to a targeted approach. That's where we engage the community, community-based organizations, faith-based organizations within San Diego County. Right now, we have a partnership with about 80 faith-based organizations. Our community health workers, which I'm so happy to see, many of them are on this call today, are out there engaging the community. And from there, we actually drill it down even further to individual and family approach. And that's where we get to the grassroots. And I can tell you that as a former marketing and sales manager, is that personal engagement is where you actually make a difference in the lives of people. It's when you actually change behavior. And we actually have so many myths, so much information that's floating around in our community. So our community health workers are out there. They're making sure that we get accurate and timely information in the hands of our people. They're making sure that we get PPE where PPE is needed to our population. And so I'm just going to share with you just a little bit of what we've been doing in the San Diego community to make sure that we reach our targeted population of African Americans and Black folk. So first of all, we have this outdoor marketing campaign. So when we started this last year, we sat down and we talked about what message is going to resonate the most. Everybody's already seeing messages saying, wear your mask, wash your hands, socially distance. But we needed a message that was going to be provocative and get people's attention, especially people of color. We wanted people to see faces that they can relate to. So we came up with a targeting strategy with a provocative message that makes people stop and look. One of them, and they were on our billboards all over San Diego County, your zip code shouldn't increase your chances of dying from COVID. We have over 28 billboards throughout the county of San Diego. They're concentrated in areas where we have the highest concentration of Black folk with culturally sensitive messages. That was really important to us. Social change starts with surviving COVID. And at the end of the day, we want people to know that our message is together against COVID. And everything drives people to our website, which is a resource and a tool where we provide information so that people can get relevant and accurate information. We have our faces on over 100 MTS bus shelter displays at bus stops throughout San Diego County. And even at trolley stops, we have faces of Black people that are represented throughout the county. We also have social media. We have a website. We have videos on those websites. We've used our trusted messengers. We have videos from Dr. Hood, Dr. Gillespie, just to name a few. I mean, it just Dr. Aflalo and many of our trusted messengers from our San Diego Black nurses, whom I saw on the call today. We have a social media company that engages, so especially so we can reach that targeted population. We've been doing video production. To date, we've developed 50 digital and social media ads. We've produced over 20 videos that we show on our website and social media. We've utilized our trusted messengers to not only do videos, but also to do webinars and to do panel discussions and to reach people. According to our social media company, we have reached 165,000 of the 180,000 Black folk in San Diego County. And that's based on the 2020 census. They say there's 180,000 Black folk in San Diego County. So we've been expanding our reach to make sure that we can get the message out to as many people as possible. We're also using our social media platforms to reach the younger population, because you've heard it. They're the ones that are the spreaders. They're the ones that's taking it home to mom and dad and grandma and grandpa. So we actually just had a campaign to work in collaboration with the county to get over 1,000 blood pressure monitors into the homes of Black people. So we used Valentine's Day in conjunction with Love Your Heart Month to get the message out that you need to monitor your blood pressure. So we're using our social media site not to only address COVID, but other underlying medical conditions that we see in the Black community, like hypertension and diabetes. And we're also using it to reach that younger target. I'm actually pleased to say to date, we've given out almost 1,000 blood pressure monitors so that people can monitor their blood pressures at home, because we're concerned about the overall health. And we want to look at this holistically. Yes, we are in the pandemic, but beyond the pandemic, we want to make sure that our Black people are staying safe and that they're monitoring their health. We also have a bi-weekly e-newsletter that we send out to those who are our subscribers. Every time someone comes to one of our webinars, we have their information, we put them on our e-newsletter. We've also used our community health workers to get the information from people that they're engaging in the community, and we can put them on, and every other week, we're sharing some new, exciting, and up-to-date information. So right now, the topic of concern is addressing the hesitancy. And as Dr. Hood said earlier, those who want the vaccine, they want it. So our challenge there has been getting them the appointments to get the vaccine. We've had the shortage. We've worked with the county on a new project they call Project Save, so that we can help those who may have a digital divide, who may not be able to go online and fill out the information to get an appointment. Our community health workers are helping to sign them up to make sure that they get appointments. We have seniors at senior centers. We want to make sure those residents who can't get out are also getting appointments. And the Black nurses have done an excellent job in making sure that we reach that population. We've done webinars. Don't hesitate to vaccinate. Our experts tell you why. We did a poll at the beginning of that, and we do it at all of our webinars to say, how many of you are planning to get the vaccine when it's available? And then at the end, we do a poll to show how many of you, now that you've heard from our experts, are planning to get a vaccine. We're happy to say that in every instance, we've moved the needle and we've changed people and we've changed the minds. And that's because there's so much information out there. So we've been trying to get the right information into the hands of people. One of the other comments that we got from our social media posts is we want to see Black folks getting the vaccine. So we've been asking people to send their photos in, and people are sending their photos in. But we started with us. We wanted people to know that we're not just talking the talk, but we're walking the walk. So this is pictures of, you can see Dr. Hood, Dr. Gillespie, myself. Oh, no, Dr. Gillespie wasn't on this one. He got the vaccine, but he didn't get the picture. Dr. Aflalo, myself, and the community health workers, we all wanted to put our picture and our faces out there to let people know that we've taken this vaccine. We trust the message that is going out, and we want you to trust it as well. And we're going to continue to build on that community bulletin board so that people can see faces that they recognize and can begin to trust the information. So where are we at in this juncture? Let me see if I can move this out of the way. So our new marketing campaign is verify and trust. We want to ensure that residents receive accurate medical and scientific data so that they can make informed decisions. We want them to be informed, not based on information, because one of our ads says that vaccine information could be deadly. So we want you to verify and trust the information. Another one of our new pieces says vaccine rumors spread faster than COVID. We want you to verify the information from trusted sources, and we want you to trust that information. And then we're actually happy that we've developed a piece, including the younger population. We have a young nurse, and that piece says the vaccine can protect us, will you? So we want to focus this campaign on not just our elderly, but also on that young population, that super spreader. So we've developed this new creative piece. It's going to be marketing. It's going to be on our billboards. It's going to be on bus sides. It's going to be flyers. We're going to do postcards. We're going to reach people in every way that we can. We have a new TV ad and a new radio ad that are being developed as we speak. We're going to roll that out. But until then, we're actually continuing with the radio and the television piece that we've been going with until we get the new one approved, because we want to continue to reach. Now, this is what the bus sides are going to look like. You've seen the billboards, you've seen the bus shelters. Our faces are going to be on the side of MTS buses rolling through San Diego County. And so I just really want to talk about some of the grassroots effort of some of our community health workers. Some of them are on the call today, and I'm just so proud of them for the effort and the work that they're making out in the community. Collectively, they're reaching over 5,000 individuals per month. So we've been working with community members. We've been making sure that they get information, education. We've been distributing PPEs. We participated in Love Your Heart Month to get out those 1,000 blood pressure monitors. We worked with Dr. Aflalo on the community health fair that was just held. And yes, even in the rain, we had over 400 people show up to get vaccinated. So those who want it, those acceptors, they want them, and we're getting them into the community. So I'm happy about that. We've been participating in food distribution sites and making sure that people have information. We have some food insecurities, and we know that in our community. So our goal is to make sure that people know where those sites are and to get them there. So we have community health workers on the right who are out there engaging at every community event that we can get to every day of the week, every month. We also helped when they were distributing the flu vaccine. We're now helping and assisting at sites where they're doing the COVID vaccine. We're speaking at churches. And Dr. Gillespie already talked about the George Stevens Community Center, where the San Diego Black nurses assisted in providing and giving the vaccines. We were there. The community health workers were there assisting where needed with the vaccines, and also giving out those flyers that talks about the myth versus the facts, because there's still lingering myths out there that we have to overcome. We've assisted with the rapid COVID testing. We've assisted with mammogram screenings, more food distribution, more transportation, and also referring people to those much needed services that they need, like mental health assistance. We were there at the George Stevens Center. We were there at Bethel AME Church, Dr. Gillespie's church. We were there at the City of Hope, where they gave out over 200, the St. Stephen's Retirement Center, where they made sure those seniors who were not mobile could get the vaccine. We've been in Solano Beach, so we're all over the county. We're at Tubman Chavez, which is in the Black community. We've worked with the Healthier Me, and that's Dr. Aflalo's YMCA Community Health Resources. So we're out there having an impact and engaging people. And what we see is that engagement really works, and it really helps to change the minds of people and their mindsets. And we're going to continue this process because 2.1% is just not adequate. And especially since we're taking it to the community, we're taking it to the sites. But again, our job is to overcome that hesitancy. And so again, we're going to continue the fight to fight the good fight together against COVID and keeping ourselves, our family, and our community safe. And I'm going to now toss it over to Leah Goodwin, who's a campaign liaison, who has been working with us in terms of getting this message out via our social media.
Well, good afternoon, and thank you, Cynthia. I'm the newest member of the team, and I have a long history of community engagement, and it's really exciting. It's exciting to do this work and for the community that we love. So I'm going to just continue where Cynthia left me and talk about the media campaign. As you see, our campaign is largely focused on getting this information, and largely with, by getting people to our website. And I hope that you guys will check the website out. This is a page for our website. There's, frequently asked questions. It is updated on a regular basis to try to give people the real facts as they're coming, as we get them. And so there's lots of videos and lots of resources and great information. So the radio and television campaign, I think I just came on board when they had finished it. And the idea of this being provocative and unapologetically Black is really, as you see, I'm going to work on this. Let's hopefully this shares the right way to share the ad, the existing ad with you, not the new one.
So we need to go back to screen share.
Yeah, I have to get out and get it first. I have to go out and get I have to stop screen sharing, go get the ad and come back. I believe that's how we're going to do it. This will stop other screen sharing. No, I don't want to. This is that moment where we all go, oh, well, we're getting it together here.
So supposedly, Leah, if you click share audio and then click the link, it will show.
Exactly. Do you see it?
Yes.
It's buffering.
Perfect. Can you hear it? You can't see it?
No.
Oh, okay. I thought you said you could see it. Simon, do you want to help me? I should have it. Let me try this again. Oh, now Sammy's doing it.
Sing grace, how sweet the sound that saved a wretch like me.
So, as you can see, we wanted people to stay watching it. And so, have a song that we know and a voice of this amazing person. And so this campaign, this ad has been run on I mean, it was run after the Super Bowl. I mean, I get really proud and excited whenever I see it running because, you know, I'm part of the team, but also it keeps your attention, I hope. I mean, you know, let us know in the chat what you think about it. But that was the current ad. And the next ad is really about, you know, taking care and getting back to normal. And maybe we'll be able to share that again. Cynthia's working on that. So you see it's been on major TV stations, and it's running daily. And we have real relationships with our television stations. And what's happened is that we've really become the go-to, and this is what we want to be. We want to be the go-to place for, you know, learning the facts about COVID and really being that trusted messenger. So one of the things that happened with the radio stations and the televisions is that we are on, our banner ad is on their homepage. So if you go to NBC7, there we are on the very top of the banner ad and links to our campaign. During Black History Month, we also became the place where television are looking for a speaker they can trust from our community. And so with Dr. Afalo, Dr. Gillespie, Dr. Hood, and our messengers and Cynthia, you know, we can say, yeah, ask us. Let's have our people talking about us on our community. And this is video number 2. And this is Dr. Aflalo, who's not with us today, who's been really a big part of our team. And I believe Simon and I are screen sharing together because some of these things left my computer when I went out. So here we have this one. Oh, that one. Thank you, Simon.
Helping generations of families enjoy life.
Welcome back to California Live. I'm Jeff Kraft. You know, it's true. Statistics show that Black communities are amongst the hardest hit by COVID. Today, I'm honored to introduce you to Dr. Aflalo, someone who's been on the front lines actively making a difference. She really is a true ambassador for the Multicultural Health Foundation's Together Against COVID Coalition. Doctor, welcome. Thank you very much for joining me here today.
Thank you for having me, Jeff.
Doctor, you're so passionate about working with minorities and underserved communities, just a tremendous advocate. Tell me all about it. I want to hear about it. Together Against COVID, what is it and what's the foundation's mission?
Our goal is to actually reach out to the African American community, educate them on COVID-19, the seriousness of it, and the importance of getting tested and staying safe.
Now, this pandemic, it's really been a crushing blow to the Black community. Let's specifically talk about the vaccine and the many opinions, because it seems like everybody has an opinion and the myths out there floating around. Do you feel there's widespread confusion in the community surrounding the vaccine?
Yes, absolutely. There's so many myths out there, but probably the biggest one is their fear is that the vaccine was produced and pushed out so quickly that they just don't trust it. So that's probably their biggest fear.
Yeah, fear, it really is the driver of these myths, which can turn extremely dangerous. Let's talk about the process. Many say it's easy, but I want to hear from you. Is it that easy?
No, there's so many barriers to equity in our health system, and we just need to make sure that the access to these vaccine sites are in the community, in their churches and in our local areas where we normally go.
Surrounding yourself with knowledgeable, fact-based medical professionals, that is what's important, which is why you have a monthly event. Tell us about that, and can others in the community get involved? Can they volunteer?
Yes, so our monthly health and resource fair is open to the entire community. We have lots of free services available and health screening, and we enjoy having volunteers and other vendors to come and share their resources also.
Doctor, thank you so much for joining me today.
Thanks for having me.
You know, we need a lot more people like you to represent the communities. There's no better time than to have this conversation right now, honoring Black History Month. Stay informed, stay safe, get all the facts, and hear from medical professionals just like Dr. Aflalo at blackcovidfactsSD.org.
Hey San Diego, NBCLX is a...
That's our Dr. Aflalo. Again, we're on major television. Of course, we then take her ad and put it on our website so anybody that missed it can see it. You get where we're coming from. So This is just the pages for our Black History Month feature takeover on Channel 7, where you see we are the banner ad on everything they did for Black History Month takeover. The California Live takeover, where we have our ad moving you to our website, making you think about us. On the California Live takeover, we took over the homepage. And in March, Channel 7 came to us and, they wanted to hear the voices of the Black community. And they asked us, can you get a group of people together? And, one of the problems is that we're not a monolithic people. We do have a lot of different opinions. And so we pulled together Dr. Hood, Brother Muhammad, and our community health worker, Felicia House, who I believe is on the line, and gave a lot of interviews, which ended up in this brief segment. And I'm going to trust Simeon because he's got this together.
More than 1 million doses have been received in San Diego County, and more than 945,000 have been administered. About 287,000 people are now fully vaccinated, which is nearly 11%. % of those 16 and older in this region. Almost 600,000 people have received at least one dose.
New tonight, Black and Latino Americans are dying of COVID-19 at 3 times the rate of white people. That is according to the CDC. Yet more than half of Black adults in the U.S. apparently are reluctant to get the COVID-19 vaccine. NBC7 investigates reporter Maury Payton takes a closer look at the vaccine hesitancy in the Black community.
We spoke to Black doctors, a spiritual leader, and a healthcare worker. They don't all feel the same way about the COVID-19 vaccine, but one thing they do agree on is that we need to build trust within Black communities. Felicia House is a community healthcare worker.
So I'm just out there in the community talking to our people.
Lately, she has been talking to a lot of people, specifically Black San Diego residents, about taking precautions against COVID-19 and resources for help. She also hears a lot of concerns about getting the COVID-19 vaccines.
We have good reason to be afraid. We have good reason when we hear something like, oh, it's warp speed. The first thing that hits our mind is, oh, really?
Recent data from San Diego County shows Black and African Americans are by far the smallest group receiving vaccines locally, at only 2.2%. 16% of vaccines administered are going to the Hispanic population, 47% to whites. This hesitancy among the Black community is something Dr. Rodney Hood sees a lot.
I've been practicing Southeast San Diego for over 40 years.
Dr. Hood says many Black Americans won't get the vaccine because of the nation's history of racism in medical research. He points to the Tuskegee experiments from 1932 to 1972, but Hood says it goes back even further.
First of all, health disparities are not new. They're historic. It goes back to what I call a long history of ethno-historic legacy of slavery, Jim Crow, and racism within the health system and without the health system. And that has caused what we call chronic structural racism.
Even Dr. Hood, a member of both the county and state's task force on COVID-19, says when first asked if he would get the vaccine, he said no. That was until he did his own research.
So as the vaccine came out, I've got on multiple task force. I put together a national task force of the National Medical Association of Black Scientists. We looked at the data, convinced ourselves that it was safe, a very effective vaccine.
Student minister Abdul Wailua Muhammad is founder of the nonprofit I Am My Brother's Keeper. His nonprofit is behind food pantries and other badly needed assistance for the Black community. He also serves on various community COVID task forces. But when it comes to the vaccine,
we are standing firm against COVID. We just have concerns as far as that go when it comes to the vaccine. And of course, I would not take it. I'm not yet convinced that this is safe at this point for our people. It is our right also to say we want to wait to look to see.
Meanwhile, Felicia House, while understanding the Black community's concerns, says in the end,
well, I did get the vaccine and I didn't, turn into a zombie or anything. So I guess you could call me a trusted messenger. I mean, now when I talk to my community, it's authentic. I can tell them I got the vaccine. About the most that I had was a sore arm.
House says before you make a decision about the vaccine, find out the facts. Don't be driven by fear or rumors. I'm Mari Payton, NBC7.
And again, according to the CDC, the vaccines for COVID-19 are effective and safe. Even though the coronavirus vaccines were developed more quickly than other vaccines in the past, they have been carefully tested.
Thank you so much. I thought that would be an interesting article to share and to show you that we're really, using the media and to our advantage. Shout out to Ms. House, who's on the call, and that's what we're doing. So we have a lot of partners because we want to make sure that we're getting the ads and the updates out into their newsletters, that our banner ad is on their newsletters, and we're really pushing people to subscribe to our newsletter. We'd love it if all of you want to stay in touch with us and subscribe. Go to blackcovidfactsSD.org, and as you see right now, right on the front page of our newsletter, you can subscribe. I want to say that it's just been an honor and a pleasure to be a part of such a, I feel, progressive and important campaign, one where we have amazing community leaders, Dr. Hood and Dr. Gillespie, who I've known, and I've known and trusted them for so long. And Cynthia and I have been community members and worked on committees and been together. And thank you all just for listening to us today. And please sign up for our newsletter. Back to the host.
And I just want to say to everyone as we wrap up sharing what we're doing in San Diego, that it's not just us. We're working synergistically with the community, with community organizations. It's a collaborative partnership. And so we're going to continue to forge ahead as we all continue together against COVID. So thank you so much for allowing us to share.
Thank you, Dr. Hood or Dr. Walks.
Yeah. Well, first of all, let me say I want to thank my team for that presentation. Some of the material I saw for the first time. I'm rather impressed with the work they've been doing and very proud of what they're doing in the community. I know some of our community health workers are on the phone, and I certainly want to give them a shout out. What I've learned as a physician who's been in this space for many years, trying to deal with health inequities and health disparities, that we're really not going to get to the bottom of it until we deal with community-based entities and engage community health workers to kind of work as a team with providers. And they are doing that. So I thank you, all the community health workers. You're making a difference. I saw the number of Blacks getting vaccinated go from 1.8 up to 2.3 in a matter of a month. Now, I'm not a statistician, but I'm going to give the community health workers part credit for that in making that dent, because they've done a focused impact on African Americans. So thank you for the work you've done. And I'll turn it over to the host and see if there are any questions.
So, Dr. Hood, thank you so much for putting this together. And thanks to all of the presenters. This was absolutely fabulous. Not just to see the effort, but to see the results. It's just amazing what you all have done. If I may, let me start with the first question. I noticed that as the vaccination group opens to the younger group, that one of the pre-existing conditions that is not included is hypertension. I think Dr. Gillespie, you pointed that out. At the same time, we were educated today that hypertension is one of the key factors in bad COVID outcomes. So how do we get the one of the things that's a bad outcome being one of the things that's not included in the pre-existing?
I think that's an excellent question, Doctor. And I think, Dr. Walks, I think the main issue is this. If you look at the data set over the last several months, when this condition first hit the door, when we first heard about COVID, that was one of the major risk factors. We all said hypertension. The mechanism by which the virus enters is through one of the receptors that has a direct effect on blood pressure. That's the ARB receptor. And there was this whole question, the ACE receptor, and it was a whole question whether this was going to be the major problem. Over time, the data that has been presented has been mixed. And when you look at multiple factors, when you look at data, you have to kind of sort everything out. High blood pressure is a very high event rate. Over 50% of the population has high blood pressure. And when you start to then tease out the data and look at the other risk factors, type 2 diabetes, obesity, et cetera, hypertension in many of these studies fell out as a risk factor by itself.
Okay.
And that's why when you have high blood pressure, it certainly is a marker of increased risk, but many people with high blood pressure have some of these other conditions, heart disease, diabetes, et cetera. So I'm not necessarily saying that's the right thing. I'm saying that that is the source of that decision. And that is why hypertension is not considered at high risk, as we all were taught at the beginning of this pandemic.
Thank you so much. Questions from the chat, Michelle?
Yes. And so Dr. Gillespie, you might have mentioned this, but so to clarify, type 1 diabetes is also not in that high risk group, right?
Yes, and I found that very interesting. I was surprised at that, and I suspect, again, when we talk about type 2 diabetes, we look at metabolic factors. We look at what goes with type 2 diabetes, high blood pressure, obesity, and the years and years of things it takes to get you to become a type 2 diabetic. It's not something that happens overnight. As you may look at the physical being of type 1 diabetics, many of them are very well in terms of their phenotype, the way they look. They're thinner, they don't have the other risk factors. They have something that occurred at birth. And by supplementing with insulin, you're able to treat that condition. So it is not considered as high of a risk when it comes to these types of things. And again, I wasn't there when they made the decisions, but I suspect that is what the basis of that decision.
Thank you so much for clarifying that. Okay, so there's a question that I think is important, especially for the people who are not on the chat room, so the people out there in the world are not seeing this, but is there any information on mixing of vaccines? For example, if you have initially taken the Moderna vaccine and only the Pfizer vaccine is now available for the second dose, can or should you take it, and vice versa? And the answer was presented, and I can read that, and if anyone wants to expound on it, that's fine. So the answer that was entered into the chat by the doctors was, COVID-19 vaccines are not interchangeable. First and second doses should be from the same vaccine, or one dose from Johnson & Johnson.
Yeah. So let me add to that. I'm sorry. Let me add to that. It is
Dr. Hood, we could hear you better before you did whatever you just.
Okay, can you hear me now?
Yes. Okay. Thank you.
The vaccines should not be interchangeable. However, there have been individuals who, with the messenger RNA vaccines, have inadvertently, purposely received different vaccines and have done well. So if somebody has received it, the data is that especially if it's a messenger RNA. With the new one coming out with the Johnson J&J vaccine, that's a different type of vaccine. But with the Pfizer and Moderna, no, you should not mix them. But if you do, the suggestion is you'll probably do okay.
Okay. So, Dr. Gillespie, did you have a comment? You need to unmute your device.
So sorry. I'm sorry about that. I thought I had.
No
As
worries.
Dr. Hood pointed out, we are trying not to have that occur. Give you an example of what happens to people who get the vaccine, who've already had the disease. Let's say you developed COVID back in May. and now you get the vaccine. Let's specifically talk about the Pfizer and the Moderna for right now. Those people on their first shot are getting major reactions similar to what many people get when they get the second shot, where you get all the myalgias, the fever, not feeling well. And that's months ago. And the real point is our bodies remember when we've been exposed to the virus. So while we are not encouraging mixing, it's highly probable it's just as effective, but the studies weren't done on that. And that's why we can't make that recommendation. The new recommendation that just came out recently about the J&J vaccine, if there's a shortage and a person chooses and can't get the second vaccine, or for whatever reason, you get the J&J vaccine, it should be 28 days later. And then that would cover you. Remember, the J&J is the one-shot vaccine. It should be 28 days after the first shot that you receive. We try to discourage it, but it's probably just as effective, but that's not based on the clinical trials.
Okay, so we've received so much good feedback in the chat room about this presentation. And again, want to thank you all so much for this information and the work that you're doing for community outreach in San Diego. So that said, is there a model for your program being implemented in other cities in California and across the country? And if not, who can local champions, spiritual leaders, or medical professionals reach out to get started? Modeling.
I'll take that question. Actually, I've had some preliminary conversations with Dr. Randall Maxey, and having some preliminary conversations with Michael and Lenore in Oakland. And I know what Dr. Maxey is doing with the Brain Health Trust, kind of like what I'm doing in San Diego. What we're hoping to do is synergize and see if we can't duplicate. I think we have a very successful community-based intervention. I think combining forces maybe in the future. I don't think the the issue around COVID is not going to end with COVID. So I think that's the silver lining. It is making hypertension, diabetes worse. Death rates are going up, not just from COVID, but from other things due to lack of health access. And so we're beginning to start focusing on that. You saw Cynthia talk about how we're trying to get blood pressure cuffs into the hands of the Black folks. There's some data in San Diego that I have seen. I'm sure it's true throughout the country, where control of blood pressure, especially in African Americans, which was fair to middling in the beginning, has actually gotten worse. And that must be increasing heart attacks and strokes. And so there needs to be an emphasis on what has been killing us for decades. And I'm hoping to work with Dr. Randall Maxey and some other folks in California on mimicking what we're doing.
That's terrific. Absolutely. Dr. Barbara Navy-Stevens, should I continue, or do you have something you want to jump in?
Well, I do have a question for Dr. Hood, and Dr. Gillespie, feel free to jump in if you feel the desire. So, as going back to the very beginning of this program, we talked about the differences that have been identified in the death rates in terms of the age groups, and not just the death rates, but also severe illness vis-a-vis the age groups, as well as the priority setting that was initially put in place, which, if you think about it, many African Americans do not live to be over 70 and certainly don't live to be over 75. And the way that the priority systems have been put in place in some areas, just by setting the priority at that high an age limit, proved to be a barrier for younger, and when I say younger, 50 and older African Americans to be able to access the vaccine. So given that this has been an evolving picture, and we see that this is potentially a major barrier for effectively vaccinating our community, what avenues are there for us to address both federal and state authorities to perhaps change the priority system and thereby remove that age factor barrier that may be, I believe, is going to be an adverse effect on getting vaccinations in as early and as fast as we can to the African American community, to those who need it the most. In addition to the fact, the other thing that was not taken into consideration in many communities and not in the federal priority setting is that there's a disproportionate number of younger African Americans, adults, who are in frontline job positions, therefore having an increased exposure, which again was not necessarily taken into consideration. They may not be nurses, they may not be doctors, but they are not being taken into consideration in having the ability to access the vaccines early. So, Dr. Hood, what can be done about this?
Well, let me start out by saying, and I guess a lot of folks on this phone know me well, the criteria should have been Black folks first and Latinx first to second, and then all others. That's what the data shows, okay? This country is not ready for that. So in essence, we always want to prioritize by equity measures. And just like age is a determinant, just like socioeconomic status is determinant, so isn't race. Not because of your biology, but because of the indirect what race means. It's kind of how people are perceived and treated around discrimination and racism. And the ones that have suffered that long enough have been African Americans. And you've heard my talk before about post-traumatic slavery disorder and that chronic stress. So therefore, you add another stressor, our system starts falling down, as you saw by the decrease in life expectancy. So if I ruled the world, I would add a race-conscious thing to age. So if it was 65 and older for whites, it should have been 50 and over for a people of color. However, for whatever reasons, maybe we can argue this for the next pandemic, because we're going to have another catastrophe in which we're going to have to do something, because I think pretty soon we're going to be talking about 16 to a 64, and we're not even going to be talking about that. But I do think what we are doing or tried to do in San Diego, realizing we're not going to get the county or the state to really make that recommendation, although we have presented that data trying to get them to do it. The next best thing is try to get them sensitive to the needs of giving us funding and resources to do special programs that target the African American community. So we're doing the next best thing with what Dr. Gillespie is doing with the Black nurses, what Dr. Afala was doing with the mobile unit, and what the team is doing with the outreach to the Black community. So targeting the Black community specifically. And when we have test sites, there's something called Project Save, where they have begun to reserve certain percent of appointments for vaccinations for people in certain zip codes. And we're trying to get them to do that at the mass sites as well. So I think if we can't get race specifically involved, then I think we should be targeting vaccination sites to reserve certain spots specifically for the underserved population.
Doctor, that's great. And I think Rodney has outlined it perfectly. The one thing that and I'm gonna be very brief with this, but the one thing we're doing right now, as Dr. Hood pointed out, on March 15th, things change. That's when everyone 16 to 64 with pre-existing diseases, which fits many of us, will be in that category. But what we are doing today in all of our programs, many of us we are informal caregivers. We take care of our older parent. We take care of the individual down the street that's elderly. So you can get the vaccine today if you're 25 years old and you're caring for someone who's older. So the way we get around this situation is that we're multi-generational. We take care of our parents. We take care of our grandparents. We qualify today for a vaccine. So when we're at our sites and in our communities, we can target those folks and make sure that our caregivers, our informal as well as formal caregivers, are getting the vaccine, regardless of age.
So are you aware, either of you, are you aware of any efforts being made to get the federal guidelines adjusted? You all are doing all you can locally, but is there any effort that you are aware of to get the
Right.
federal?
As of next week, it's going to be a moot point after March 15th, because then we're, you know what I mean, we're moving in a whole different category at that point. So, you know, I think that's going to be, for this time, we're going to deal with it. It's a week away.
Yeah. So the answer is no. I think across the nation, they're all doing that. Although we're talking about March 15th going to 16 and above. That really depends upon how much vaccine there is. But other parts of the country may not be there. So but I can tell you in the like the National Medical Association COVID Equity Task Force, this really hasn't come up. And when I've been on national panels, I'm usually the only one bringing it up. I am telling you, it is the elephant in the room that nobody wants to talk about. When we talk about how Blacks and other minorities are at greater risk, and then we talk about the solution, nobody wants to talk about, if you're Black, you should be first in line. So I honestly don't see that happening, but I do think we should continue to have that conversation.
I just had a quick comment and maybe a question. Looking at the just amazing work that you all are doing in San Diego, I think it's remarkable. And one of the parts of what you presented today that struck me the most is how it's not just the doctors. We're dealing with a health issue, but what Cynthia James Price talked about, what the other folks talked about, with reaching people where they are, with not only getting out into the churches and what have you, but also this huge media campaign has just been tremendous. And so, because we're not all going to suddenly get healthy when COVID-19 becomes less of a pressing issue in our communities, how have you all looked with longevity at this kind of community outreach? How will you continue to reach into the community the way that you're doing now as other things continue to come after us and continue to try to kill us?
Yeah, so let me take a stab and then I'm going to ask Cynthia to comment. The county has already insinuated to us, our grant and program has been funded through the end of June. They're already talking to us about extending that beyond, and not just to deal with COVID, but to deal with the other secondary issues, hypertension and things like that that are killing folks. What we found, a Multicultural Health Foundation is a very small community-based organization, and our main problem wasn't getting funding, it was building capacity. So we were building capacity and at the same time trying to implement. And thanks to Cynthia and Leah and the community health workers, it's been a process of love. But I believe there's a future beyond. And that's why I think having conversations not only in San Diego, but with Dr. Maxey and elsewhere in the state of California, it is going to be critical. Cynthia, you want to comment on your insights?
Sure, I'd love to. And I just want to add, thanks to Dr. Hood's connection, we talked about looking at models. We actually had an audience with the Biden-Harris COVID transition team before they were inaugurated. And they were interested as well in how can we reach our BIPOC population. So that seed has been planted there. But as Dr. Hood mentioned, we have been contacted by numerous organizations who want to work with us. And our issue, again, is capacity. And so we are now working with an organization who is going to come in and augment some of our efforts that we're doing with COVID-19. And then they want to look beyond. They have a hypertension program, and they've been looking at their numbers, and it's just gone off the rails in terms of people monitoring their blood pressure and hypertension control. And so we had a conversation last week, and they said, we want to work with you now to reach all the health systems so that they can reach people of color. And so that's during COVID. But beyond COVID, we want to talk to you about how can we look at other health inequity issues. So the work that we are doing has been noticed by others, and we're happy about that. So some seeds have been planted, and we are looking forward to beyond COVID.
Yeah. So to add to that, it's like the entities that we're talking about are the major health systems in San Diego. We're talking about Scripps, Sharps, University, et cetera. In essence, they looked at their data and saying we're losing control of blood pressure, especially in African Americans. They approached us about what we were doing with COVID, about developing similar messages that they can then incorporate into their systems focused on their African American communities.
So thank you all so much. We're running out of time, and as I always have so much that I want to say, let me just point something out. And I hope Dr. Maxey is listening, because the seeds that we plant are just amazing. And as we say in church, some plant, some water, and God brings the increase. And I think Dr. Maxey, the Black Health Trust really does reach from sea to shining sea, because we've heard a tremendous effort and impact in California. And a few weeks ago, we heard from Reverend Pointer and some amazing community work that was being done in upstate New York. And and I hope that once we get the Black Trust website perfected, and all of these will be archived, because I'm just thinking what a joy to be able to look at the work being done in San Diego and the work being done in northern New York, and know that the Black Health Trust is able to bring this information together literally from sea to shining sea. So I just want to thank you all so much for what you shared with us today. I feel inspired. And Dr. Nabrit Stevens, I'll toss it back to you, please.
Can I just, because I'm going to end, I haven't seen this man in a while, I just need to give a shout out and say hello. Nice to see Dr. Wilbur C. Jordan. Okay, just wanted to tell him about that. Thank you, my friend. Sorry about that. Hadn't seen him in a while.
Dr. Walks, there was a few quick clinical questions in the chat room, but we can address them at social@blackhealthtrust.org.
Oh, well, we will definitely address those, because they're not quick answers, and we will address them next week, because clearly if these questions are coming, we need to go back through that subject matter again. But before we close, I want to thank everyone for joining us today and participating. I want to thank our fabulous panelists, and I want to invite everyone to come back next week, and we're going to close out with our aspirational word. Miss Brenda Lieger, you ready?
I certainly am, and thank you guys. Thank you so much for this panel today. It was wonderful. It's just so much that we learned. So in that, I'm going to take a breath. I'm going to ask you to take a breath with me, and I'll go into a short prayer. There's a power and a presence in this universe. We call it God. It is everywhere present. It is my life, and it is your life. It's all we live and move and have our being inside the presence of God. So all of the beautiful doctors and all of the beautiful scientists and all of the laymen, all the people, all the nurses and everyone who takes care of us through this period, you are loved, you're appreciated, and you're protected by the guiding force within us. And I give thanks until next week. We just know that We've come this far by faith, leaning on the Lord. And we keep on leaning, and we keep on learning, and we keep raising our awareness till we know that all is well. I give thanks, and so it is. Amen.
Thank you, everyone. See you next week. Bye-bye.
Have an outstanding, safe week. Take care, everybody.
Thank you, everybody.
See you next time.
Bye, everybody.